we start to wind down the month of October, it's important to keep breast cancer awareness on your mind. Dr. Elizabeth Vaughan is here now to suggest ways that we as women can reduce our risk of breast cancer. Good morning.
Good morning, Cindy. How are you?
I'm doing well,
Good.
doing well. The risks of breast cancers are?
Well, the most common ones that all doctors accept are increasing age and family or personal history of breast cancer, along with many other risk factors for breast cancer.
But you have some other thoughts.
I have some other thoughts about it. I've been a doctor for 30 years and treated a lot of women and done a lot of studying. An imbalance of estrogen to progesterone. Progesterone does a search and destroy mission on wayward cells that are fed by estrogen. So progesterone supplementation, starting when you begin getting more severe PMS, say late in your 30s, early in your 40s, usually caused by estrogen. Too much estrogen compared to progesterone can reduce your risk of breast cancer 15 to 20 years later. Also, if you go on estrogen replacement therapy, say after you have a hysterectomy, I'd recommend that you also take natural progesterone to counterbalance the effect of the estrogen on your breast tissue.
Yeah, we hear a lot about that, about estrogen in induced breast cancer. What about supplements, though?
Well, there are lots of different supplements that you can use. The important thing is that low vitamin E, D, folic acid, and B6, omega-3 fats, and iodine are all clearly linked to a higher risk of breast cancer.
Low, so how does that work?
Well, vitamin E along with vitamin C and selenium are antioxidants. They sop up all the free radicals that damage cells and DNA and lead to cancer. Vitamin D triggers cell death of suspicious cells and blocks the ability of established cancer cells to grow new blood vessels to the cancer itself. So, no new blood vessels, no food. Cancer starves. Omega-3 fats, like those in walnuts, canola oil, salmon, and flax seeds, reduce inflammation, again, so we don't produce as many free radicals. Folic acid and B6 help to protect and repair your DNA, and they virtually eliminate the increased risk of breast cancer from alcohol consumption if taken in high enough doses. And iodine is necessary for lymphatic drainage, which carries toxins out of the breast, including estrogen, which is actually made in your breast when you're postmenopausal. Healthy breast cells also use a lot of iodine, so you want to have plenty of iodine on board.
Aren't there foods that we can eat too, though?
Yeah, there are foods that you can eat. Pro-inflammatory foods like trans fats, too much saturated fats, too much sugar, too little healthy fats, all increase inflammation. Roughage helps to detox your body, including taking estrogens out. Avoid getting diabetes. The worse your blood sugar control, the greater your risk of cancer. And again, this is due to inflammation and free radical formation. Instead, eat lots of colorful fresh fruits and vegetables, especially cruciferous vegetables. They're the best ones when it comes to reducing your risk of estrogen-sensitive cancers.
But broccoli, I mean, 2 cups, you told me 2 cups last time.
I know it's up to a pound of broccoli a day now. The latest reports are a pound of broccoli a day. Enjoy your broccoli, eat it frequently, but take diindole methane, a supplement which comes from broccoli, for good insurance.
Of course, always we talk about toxins.
Always we talk about toxins. First, the average American has 91 environmental toxins in each of us. Many of these are estrogenic. Some of us can handle these without any obvious problems, but others get sick and stay sick. Give me your hand.
Uh-oh.
This much pressure, okay, stops lymphatic flow. And toxins go into our tissues through the bloodstream and come out of our tissues through our lymph system. So just this much pressure stops lymphatic flow cold. So if you wear a bra that causes breast pain or tenderness by the end of the day, or leaves red marks on your body when you take it off at night, get a lighter bra, a camisole, or go bra-free as much as possible. You have no lymphatic flow out of your breast to carry toxins out of your breast when you're wearing a tight bra. Your breasts will be healthier for it.
And you'll feel good.
And you'll feel so much better.
But the key is you got to take care of your breasts now. Take care of yourself now before the cancer can form.
That's right. It takes 10 to 15 to 20 years for a breast cancer to grow. So take care of your breasts right now. If you get cancer, despite all of your best efforts, clean up your act, because what I'm suggesting that you do, it will help you survive that cancer and help prevent you from getting the next one.
The good news is you have a chance to talk with Dr. Vaughan a little bit more. She's going to go on our website, myfoxwghp.com. She will be answering your questions. You can also go to her website, vaughnintegrative.com.